To call it a matter of life and death is not hyperbole. With the fourth wave of COVID-19 rolling across Europe, physicians here in Germany are warning of disastrous trade-offs as intensive care units reach capacity and patients are transferred abroad for treatment. Hospitals are seeing younger and sicker patients than in prior waves, especially amongst the unvaccinated. In Germany, some 15 million people still lack immunity because they haven't had the jab. Calls for mandatory vaccination are growing louder. Neighboring countries like Austria are leading the way. Other countries are reimposing lockdowns, not without resistance, as evidenced by recent protests. Today, we're asking COVID-19 pandemic, should vaccination be compulsory? And it is a pleasure to welcome our guests on To The Point. Alexander Kekulé is a virologist from the University of Halle, and he says a general vaccine mandate would not improve the present situation. It's a pleasure to welcome Kupferschmidt. He is a molecular biologist and science journalist who says Germany has neglected the hard work of public health that would have helped avoid mandatory vaccinations. And we're very pleased to have with us Susanne Schreiber. She works with the German Ethics Council. And she says the German Ethics Council recommends mandatory vaccinations for care professions. So I'd like to start by hearing the rather dire warnings that we have been hearing from some of Germany's leading health officials.
The whole of Germany is one big outbreak. This is a national emergency. By the end of this winter, pretty much everyone in Germany will have been vaccinated, recovered, or died. This may sound cynical, but it's true.
Alexander Kekulé, would you agree, or would you say they're overstating the situation?
They're not overstating. I do not know if everybody will be dead or vaccinated or recovered by that time. But the interesting thing is these guys are part of the problem because they ruled the country when we came to this situation, and now they're ringing the alarm in a way. But we really have to face a situation where everything we can do now and can do quickly is really to be done. We must do things which have an effect right now and not things which might have an effect next year or later.
Susanne Schreiber, how do you see it? Were those warnings absolutely justified, or would you say, no, maybe that wording is a bit cynical?
No, I have to say I'm tremendously concerned. The numbers are really high. I'm really worried about the hospitalization rates, about the system breaking down, of us not being able to get treatment even without corona in the coming weeks or months. And so we really have to do something. And as Mr. Kekulé said, time is really important, but I think we also need the long-term perspective. So we need to act now, but we also need to think about the fifth and the sixth wave.
Kupferschmidt?
I agree that the situation is really dire and we need to act. I do think Spahn's words are wrong, and they're wrong in an instructive way, because I think we've had this idea for a long time that stuff happens very fast in this pandemic, and it's simply not true. If you think, you said 15 million people are unvaccinated. If you think about it, if 100,000 people, unvaccinated people got sick every day, that would take 150 days for all of them to have gotten the disease. That's almost half a year. And it wouldn't be sustainable at all. 100,000 cases a day are exactly what's not sustainable. So clearly we are heading for a situation where we need to act. I completely agree. The action will probably include contact reduction. So we won't call it a lockdown probably, but it will be some kind of lockdown. And at the end of the winter, we'll still have a lot of people that aren't vaccinated or recovered. And I think it's really important to remember that, because I think we keep making this mistake. This isn't like one little short catastrophe and then it's over one way or the other.
Let me ask you, Alexander Kekulé, why this fourth wave is hitting so much harder than the previous waves last winter, and that despite the fact that 68% of the population here in Germany is vaccinated.
It's just a question of magnitude of infections. We had, during the summertime, we let many people in the country without any checks and any tests who came from the high incidence areas. So this was politically meant because there wanted the people coming back from vacation to have their vacation. And then next thing was they opened schools without any preventive measures. So the masks were put away, the testing was sometimes in place, sometimes not. And most importantly, they said we do not have quarantine for contacts at school. They put only the people out of school who are positive, and the rest of the class stays inside. So this made a breeding ground for this virus, and now we have a high number of infections, and then on top they allowed people who are vaccinated to have, I say, full party in Germany. They have uncontrolled conditions for their gatherings. They can gather inside without mask, without the contact restriction or distance. They are not tested anymore because they think we are healthy, and there's no maximum number of participants for these events. And so we have outbreaks with thousands of people who are vaccinated or recovered, who think I cannot get COVID because the government told me everything is safe. And now we have this wave of people who get not seriously sick. That's very important to say. They don't get seriously sick usually, but they make a high incidence of cases. And then this wave, of course, goes over to the people in the nursery homes and so on.
And we're going to take a closer look at that in a moment. But let me ask you this, Kai Kupferschmidt, because you said that, in fact, Germany has neglected public health and the hard work that goes with proper public health policy. So are you saying that what we're seeing right now is the consequence of political incompetence?
Look, I mean, what we're seeing is the consequence of a lot of things coming together, right? And I think one thing that Alexander Kekulé didn't mention just now is the fact that we are dealing with a virus that is very different from the one we dealt with in the last winter season. The Delta variant is much, much more infectious. It seems to make people sicker. So that already changes the game immensely. And I don't even want to think about what this wave would look like in this winter if we didn't have the vaccines. So clearly we're dealing with a virus that in some senses is a new virus and a more dangerous virus. And then on top of that, what I mean when I say we haven't done the public health measures that we need to do, I think we still, even though this is now 2 years almost of this pandemic, we still haven't managed to really communicate to a lot of people why certain measures are necessary. And particularly politicians still haven't learned that no matter what they do, what matters is doing it fast and doing it early. Instead, we're having a debate about now looking at basically at hospitalizations instead of cases, when cases are, for us, an early warning signal. I said on Twitter, it's a little bit like having a smoke alarm, but then setting it to a setting where it doesn't beep when there's smoke. It only beeps once it starts melting from the heat. It doesn't make sense.
Susanne Schreiber, did politicians and perhaps many citizens as well place too much faith in vaccines? Would you say that in a way we engaged in wishful thinking?
I think it was important to really put our trust in the vaccines, and in order to motivate people to get the vaccinations, it was really important to show their power, which they have to prevent serious disease. And perhaps in that communication effort, it has fallen too short that we have this decline in the effect on contagiousness, so that basically we can still be contagious, not as strongly as the unvaccinated ones, so they definitely contribute way more to that, but there is a risk for the vaccinated ones too, and we need to be aware of this. So all these strategies that we now have that seem to combine the vaccination and the testing is the thing to do in these times of crisis where numbers are really high. And I fully agree with the temporal argument. So we have to be really, really fast. And that's something, this whole discussion we had in Germany about incidence versus hospitalization, that was really difficult. So we still need incidence.
I'd like to take a closer look at what soaring infection numbers actually mean on the ground for hospitals.
It's a matter of life and death in this intensive care unit in Frankfurt an der Oder. Day and night staff members are here for their patients, whether they are unvaccinated coronavirus patients or, like this man, recovering after a transplant. The fourth wave of the pandemic is pushing nurses and doctors to their limits. I think things are going to get very tough again for us here. We're going to have to come together to manage somehow.
Oh, yeah.
Across Germany, hospitals are turning away or reassigning critically ill patients because their intensive care units are full with unvaccinated coronavirus patients. That's not the case here in Frankfurt an der Oder, because many COVID-19 patients die quickly in spite of the efforts of the medical staff. If only I can save 1 out of 10 patients, it's worth it, even for that one life. Who is to blame for the intensive care unit emergency?
And let me put that question straight away to Alexander Kekulé. At least some of the patients in the intensive care units are vaccinated people. To what degree are they to blame?
I think you cannot blame the vaccinated, because the promise has been a sort of a false promise that when you are vaccinated, you are safe. So they really believe this, and not everybody is a virologist or an epidemiologist and who can really judge it on himself. But I would say we have now the situation, the intensive care units are full. We have less personnel than last year, so we have less beds in the intensive care units, and it's therefore really necessary, and this has already been done, in fact, by the specialists, to look again at the incidence, at the number of new infections. That's really the number which counts now. But the problem is we just have a new law that says the countries, the Länder, have to decide on the basis of the number of hospitalizations. And that's really a problem, because when you have a general number for one Bundesland, then you have the situation...
Federal state.
Yes, federal state. Then you have the situation that in one part of this federal state, you might have a very high incidence and high number of beds occupied, and in another part, it's not the case. So but then the average of the whole thing is the basis for your decision. This means perhaps in some part of Bavaria, people are really dying because you don't have enough beds. But for the whole country, you would say no, we are below the average. The other way around is also dangerous when you have strict restrictions for the people living in one part of a Bundesstaat where you have low incidence. They will not understand that they cannot go out of their door anymore, because in the other edge of the country the hospitals are full. So we are not better now. We are not better off with this new law. We have more problems now.
I want to come back to the law in a little bit, but let's talk some more about how we got to where we are and who's responsible for that. And Kai Kupferschmidt, many doctors are saying, on the basis of what we just saw there in that report, that the situation is rapidly spiraling out of control. Do you think that's right? And who or what is responsible in your view?
Well, I mean, like I said before, I think us reacting too late is a huge part of it. I mean, I think from my point of view, the idea of measures was always to avoid a situation where the hospitals are overwhelmed. Instead, we're making hospitals being overwhelmed the measure for putting in measures. It doesn't make sense. I do wonder sometimes, like I see certainly when I also look at polls, it looks like a majority of Germans are actually often in favor of either the level of restrictions we have or even more restrictions. And yet politicians seem to be very, very hesitant to put this in early and to put in the hard work of explaining to people why it has to be done and why, if everything works, they're not going to see anything. Because that's, of course, always the paradox of prevention, right? You're trying to avoid that there's anything to see in the first place. But, I mean, these are things that we can communicate to people. And I think it is, maybe I'm biased because I'm a science journalist, but to me, the biggest failure in all of this has always been a failure of communication. And, of course, that communication goes back a long way. If we look at what's the difference between countries like Denmark that do very well and Germany that don't, it's trust. And that trust in public health institutions, the trust in government, that is something that communication builds over years and years. And it's a reservoir you use in a pandemic, and we don't have it. It's dry.
Can I just jump in with a question? Because, of course, the perception in many countries abroad is that actually, at least in the first phase of the COVID the epidemic, that the Chancellor, Angela Merkel, communicated admirably. In fact, she won an award from an American university for her communication in the handling of the pandemic. Has that changed, or would you disagree with that perception?
Look, I think, so first of all, Germany did well early in the pandemic. I think that had less to do with the communication being so stellar and more to do with us testing very early on and testing widely and going into a lockdown fairly early on. And maybe, maybe people also felt because we did well, there's less of danger now and it made the communication later worse. But I do think that the communication that didn't work, it has to come from many sources. It's not enough to have a chancellor, every now and then giving a nice, giving her spiel about the numbers. You do need, for everybody in society, you need people that they also trust. We need to have people out there, whether it's, community leaders, priests, imams, whatever it is. These people need to be part of the communication, and we haven't really done that work.
Susanne Schreiber, clearly many people trust online websites, including conspiracy websites, including fake news websites, far more than they trust their public officials. Aren't they, to some degree, to blame for the situation that we see in the hospitals when we say that there are many people who remain holdouts against vaccination, despite the facts that they do, in fact, often or could be receiving from health authorities?
I'm not sure we should blame the individual people, because what they try is to get information. And then the question is, which is the trustworthy part of the information? And I think we can blame, just very generally, perhaps the media, that they can make a better effort to make sure that we understand which are the trustworthy sources. But to some extent, that's very hard to manage in times of social media, where everyone can choose and where it's even for the press really difficult to decide which people do you invite to talk shows and things like that. So how balanced is the situation? Because in science, for the new scientific facts, we don't have a clear-cut system where it's clear 90% of scientists believe this and only 10% believe that, right? So if you have two opinions, you invite two people, and that also distorts the view. But it's very difficult to handle. So I wouldn't blame, but it is a problem. Yeah.
Alexander Kekulé, are you seeing any uptick now in the vaccination rate as more and more people do see images like the one in that report we just showed? There's some talk of this, but do you see scientific confirmation?
No, that's not scientifically confirmed yet. We have signs of this. Because, you have sort of three kind of people who are not vaccinated. One is really the hardcore anti-vaccine people who you will never, I think, convince them, at least not in this pandemic. So my stand is leave them alone. Open society has to live with this kind of people. The second part is those who move when you push them a little bit. Means like we have now these 2G things where you can go only when you're vaccinated regularly to some events and go to theaters and everything, and even now to work you have to test daily. I think this will convince many people who are lazy, more or less, and that's another push. But then there's another part which is the second part is, by the way, not only typically German. That's everywhere. This was in Austria. This is also in the Roman countries. It was the same situation in France. But then there's another part where I think that's perhaps a little bit German, because the German countries, they don't like people who tell them what to do. They are a little bit anti-authoritarian people, like children. And when somebody says do this and do that and that, they go and Google and find to check out if this is true or right. You can think this is a nice trait, but at the end of the day, this makes it very difficult, because you really have to convince these guys, and they have different information. And I think we can give more input on that part. These people, I'm very optimistic. They will also many of them will decide to vaccinate when we have these new vaccines, which are not gene technical vaccines, no RNA vaccines anymore, conventional vaccines, which will come up in the first quarter of next year. Mm-hmm. I think we will have another boost of vaccinations when these guys go to get the jab.
Thank you very much. As debate rages here in Germany, neighboring countries are taking drastic action in the face of ongoing vaccine hesitancy of the type we're talking about. Austria, for example, crossed a crucial threshold last week. Will other countries follow suit?
Austria will be the first European country to make vaccination compulsory from February. A full lockdown, including for the vaccinated, is currently in place until mid-December. After that, it will only affect the unvaccinated. In Vienna, 35,000 people protested against the measures. We don't want vaccination to be enforced from the 1st of February. It won't stop at mandatory vaccination. It will be like this forever. In France, the vaccine has been mandatory since September for employees of retirement and nursing homes, hospitals, emergency services and fire departments. 15,000 people refusing the vaccine have already been suspended without pay, and further measures are planned. Belgium, Italy and Latvia are similarly strict with hospital and nursing staff. What measures can best see us through the 4th wave?
Kupferschmidt, in fact, Germany's soon-to-be Chancellor, Olaf Scholz, has not ruled out compulsory vaccination. What would you advise the new German government? Is it time to take more decisive action? And if so, more in the direction of Austria or more in the direction of France?
OK, so first of all, I think it's very good that he hasn't ruled it out, because I think this has been one of the really bad things in this pandemic, is politicians constantly ruling things out, which then just makes them later have to eat their words and have to rule it in after all. So I think that's the right thing to do. I think we need to have a discussion now about it. I personally have always been against mandatory vaccinations. We know that they have a lot of negative effects in terms of the psychology, in terms of getting people also to vaccinate with other vaccines. There's a lot of things to think about. This is a very complicated debate to have. I am inching closer and closer to thinking that in this particular case, there might not be a good way around it, but what we know about the vaccines also makes it very hard sometimes to argue for it. So I think it's right to have this debate now. I think the debate itself might already, clarify. That's the kind of communication we need, like to have that open communication to talk about it. But I do want to say one thing, because we always talk about these extreme measures like mandatory vaccinations. And of course, mandatory vaccinations can have it can look very differently depending on how you do it. It can be mandatory to go to a doctor and get advice on a vaccine, but you can still opt out. It can be mandatory to have an appointment. It can be mandatory to actually prove that you're vaccinated. So this is not, black and white. We have to debate if we're going to do it, and if we do it, how to do it. But there's a lot of people also, what I see in a lot of other countries like Portugal and Spain is that people get an appointment to be vaccinated sent to them, whether they don't have to do anything. And it's basically an opt-out solution. And we know from organ donation and other things that these opt-out solutions already make a huge difference. So I wish, when I said that I think we've neglected a lot of things in public health, I wish we'd built the kind of public health infrastructure that allows us to do things like that. We probably don't even know who the unvaccinated people are we need to target. And that's a huge problem.
Susanne Schreiber, you mentioned in your opening statement that the German Ethics Council has issued a recommendation. What is it? Mandatory vaccination, at least for some?
Yes, it's mandatory vaccination for those who deal with the vulnerable. So we've been observing that in the care houses for the elderly, many people die despite being vaccinated because the ones who care for them are not vaccinated. And this is something where we said it's so significant that we have asked politicians to now really check whether they couldn't enforce something like that. But I also have to say that although the German Ethics Council so far said that we are against a general vaccine mandates, we are taking discussions up again about this because we see how hospitals are overwhelmed. And the threat to our healthcare system, the threat to the hospitals, that's the point where we say we need to do something. Whether in the end the Ethics Council will say this is mandatory vaccinations for everyone, we don't know yet, but at least we have to discuss it because that's the game changer, right? It's not about the protection for oneself, where everyone is responsible for themselves, but it's threatening. If I have a heart attack tomorrow and I can't be treated in the hospital, no matter whether I'm vaccinated or not, I have corona or not, right? That's a big problem. And even those who don't get vaccinated, their loved ones could be facing these problems. And that's something we simply have to take into account as society, and that changes the game.
Alexander Kekulé, your opening statement said ruled out a general mandate for vaccination. Would you go for this more targeted variant?
Yes, this was my proposal many weeks ago, before the Ethics Council had this proposal. We have to do things which are working right now. The house is burning, and it's no use of discussing vaccination, which is a long-term prospect. We have to do the boostering, the booster vaccinations for the elderly, that's something that is really necessary. We have to test everybody who goes into the nursery homes, and we have to think about lockdown measures means distancing, forced distancing. That's the thing which works right now, and everything else, the whole discussion about possible general vaccine mandate, I think that's really putting fuel into the fire.
Thank you very much. Very quickly, Kai Kupferschmidt, it's often said COVID's on its way to becoming endemic. What does that mean for the future?
We don't know. Endemicity just means that most people have been exposed to the virus before. It doesn't tell us anything about what exactly. In the worst case, endemic coronavirus can look a lot like what we're going through at the moment. So that's the reason that I think we do need to have this debate now, because otherwise cases are going to go down again in the spring, and then that urgency is lost, and then we end up in another winter if we're unlucky with no idea about whether we need a vaccine mandate or not.
Thank you very much. Thanks to all of you for being with us. Thanks to you out there for tuning in. See you soon.